So my practice in spine, because it involves both non-operative as well as operative care. On the operative side, I do mostly a minimally invasive spine work, but I'm also trained in traditional spine. So there are times where for a patient, the minimally invasive option is the best alternative, and there are times where it is not. And so we try to custom make the procedure instead of get into the mindset where I do X, Y, or Z and I do the same thing for everyone. I think for most patients, in fact the majority of patients, you don't need anything beyond a conservative approach. So that being a time, doing medications, anti-inflammatories, therapy, maybe injections. So most don't need a surgical intervention, but for those who do, that is the right approach. And we try to not jump into it, obviously. So I do teaching on different levels. We teach residents who come through our office, and we also have training where I fly off to different centers and help other surgeons learn minimally invasive techniques. But no, as far as the approach in the office goes, every patient has their own problems and other set of factors, work and life and such. And so we try to customize care, individualize it to your condition as well as your life. There is a big role for physical therapy. Most patients need it as a primary treatment option and don't need anything beyond that. There are times where it is used post-operatively. A lot of these minimally invasive procedures don't actually need it, but a lot of them do. And when it is needed, we chart the program and then we follow it by staying in communication with the therapist. Nowadays, there's not much distinction between neurospine and orthopedic spine. However, historically, it was the neurosurgeons who did the decompression, so they would free up the nerves, if you will. And then it was the orthopedic surgeon who would do the instrumentation, i.e. put screws and plates and things in the spine. Training now is such that you're trained in both aspects. Training in neurosurgery, I do think is still a little more focused on the decompression side, while on the orthopedic side, it is more geared towards doing the instrumentation part. And so the advantage of dual training, where you're actually going through both programs, is you do get that extensive experience on both sides, and I think that helps with patient care as well as optimizes outcome. A minimally invasive surgery is basically you are trying to minimize the amount of tissue disruption. So it's become a buzzword, but I think the principles of it is that you're trying to attain the same goal, which is to unpinch nerves and or stabilize the spine. It's how you do it. A traditional surgery was more invasive in the sense that you would cut the muscle off the bone to gain access to the nerves. Minimally invasive is aimed more at doing a non-disruptive or a minimally disruptive tissue surgery. So you don't do a lot of collateral damage before you get to the nerve. And there are different procedures which are used. So a common one we do a lot is called the X-lift, which is a brand name, but it's a direct lateral approach to the spine where you come in from the side, and so you don't cut all the back muscles. And so that's one. We also do some minimally invasive screw placement, and we recently just did the first one here in the United States called the facet link. And that's basically a way to fuse the spine with the screw but not use rods, so you get the stability without the tissue disruption. I think that success after surgery is really defined by the patient. It depends on your goals. So we have athletes who have been able to get back to sports like golf and running and basketball, which they were not able to do before surgery. Because I think it's very exciting what is happening now, and I think that over the next 10 to 20 years, spine is going to change significantly, and to be a part of it and to help facilitate that change is extremely exciting. And I think in time it will only improve and help patient outcomes and just enhance patient recovery after these procedures.